Okay, let's get started on the important concept of infection. This is page 555 in your books. And an infection is just when a foreign organism enters the body. There are multiple different types of infections, as you guys are aware. There's bacterial, there's fungal, there's viral, there's protozoan, parasitic, prion. They're classified differently. They're classified, you guys know, as according to the type of organism they are. And it can be from a mild inflammation to something very severe like septic shock. And so let's go ahead and get started. As always, it's really important that you take a minute to look at the learning outcomes. And then, once you're done with the PowerPoint, go back to the learning outcomes and make sure that you understand the various points. Okay, so first, just as always, guys, remember that you want to review the anatomy and physiology of the cell and the infectious process on your own. This is in your book on page 556 to 563. And, as you guys are really starting to catch on now, there are always multiple terms at the beginning of a chapter that you need to make sure that you understand. I think you guys realize now as nursing students that these terms often show up in the stem of questions, and you need to make sure that you understand it. And so the concept of infection is no different, guys. There's multiple terms that you guys need to understand. I want you guys to review the chain of infection. This is an excellent picture that depicts the chain of infection. And I also want you to look in your books and then review table 9-3. And it's really a great chart. It shows you how to break or what we should do in order to prevent breaking the chain of infection at the various points. You're going to read it and you're going to think it's very much common sense type of interventions, but still, it is important to review. So that's table 9-3, that's on page 560. And also what you guys are going to be encouraged by is the fact that many of the things that are in this chapter you guys did learn in essential concepts. Okay, so first look at box 9-1 on page 561. It shows you the different kinds of organisms that cause infections. It actually helps us to understand the infectious process and why certain antibiotics or certain drugs are prescribed. We entered the infectious process because we have an alteration in the immune and inflammatory systems, and a pathogen is allowed to enter. And, in the United States, we're doing better, but, we still have a ways to go. So, for instance, in the United States, we're having an increase with STIs, but many third world countries are still dealing with, like, malaria and TB. And so the other issue that we're having in the United States is that we have produced the resistant strains of microorganisms to certain antibiotics. And so it's important for us to understand the various pathogens that are causing the infections. And so if you guys look on page 563, it talks about the stages of the infectious process. And this is probably a review. But we look at the first stage, and the first stage is called the incubation period. And this is when, the pathogen enters, it begins to replicate, but we have no symptoms yet, and it can last from a few hours to days. Now, we get into the next stage, the prodromal, then we have symptoms that begin to appear. And they can be general in nature, like malaise, fever, muscle aches, headaches, fatigue. And during this particular stage, we move into the illness stage. And the illness stage, that's where we feel the worst. We have the cell lysis going on, we have an immune response going on, we have tissue damage and inflammation occurring, we have fever and chills, we can be tachycardic, tachypnic. We could have localized manifestations if we, for instance, have a wound that can become red, warm, swollen, painful, possibly produce some kind of discharge. And hopefully this period is not prolonged, but if the illness stage is prolonged, we can have muscle wasting and loss of body fat. And then eventually we'll move from the illness stage into the convalescent stage, and this is when recovery occurs. And this is when the tissues are repaired and the signs and symptoms of the infection resolve. When we look at the complications that can occur based upon someone having an infection, there's so many that we can't possibly cover them. So I just pulled out some of the most complicated ones. I mean, I didn't even mention the fact that if someone, for instance, has a MRSA infection in a wound, they could develop a wound abscess. Someone has pneumonia, they could develop, a abscess of the lung, an empyema. But anyway, so let's talk about sepsis and, what that means. And sepsis is, when pathogens enter into the blood or the other tissues. And always the issue with sepsis is that we're so afraid it's going to lead to septic shock, which is a medical emergency. We know that septic shock, almost half of the patients that end up with it die. And so it is just an exaggerated response to the sepsis, but it has a quite high mortality rate. Bacteremia is the presence of blood, or the presence of bacteria in the blood. When we look at the antibiotic-resistant bacteria, you guys are probably becoming very familiar with this since you've been in clinicals and you understand the different types of isolations that we have. The big ones are MRSA and VRE, and we know that the MRSA and VRE are both by, direct contact, that we can put someone in contact isolation and cover these. They're not respiratory. The ones that are respiratory would be the PRSP, which is the penicillin-resistant streptococcus pneumonia. We also, unfortunately, have what we call a multi-drug resistant tuberculosis that is occurring in the United States. And we also have a MRSA that is resistant to the usual treatment, and it is called Visa or Versa. And so this continues to increase at an alarming rate in the United States. And then we have biological threats, and those would be like your anthrax, your smallpox, pneumonic plague, hemorrhagic fevers. These guys actually have to be reported to the CDC for disease surveillance, so we know if there's an actual issue. Next, we need to talk about HAIs, and so we're talking about healthcare-associated infections. You guys are already seeing this. You hear a lot about this when we're in clinical practice, and so what we're looking at is the fact that they cost us billions of dollars a year, but not just that, guys. It costs a lot of lives each year. And so it also leads to added hospital days and, beds filled up with people who have HAIs, and so we cannot get new admits. When you're looking at the different types of HAIs, for instance, one that your book talks about is what we call ventilator-associated pneumonia. And so this is why we talked to you guys about trach care. And we said there is a particular way you do trach care. It is one of the things that we still do sterilely. It is so we can not encourage a ventilator-associated pneumonia. But we also have to take good care of someone who is intubated and on a mechanical ventilator and follow the policies and procedures to help prevent VAP. Next, UTIs. Most common type of HAI is UTIs associated with a Foley insertion. So this is why we have particular Foley care that needs to be done, and we have a way that you need to insert the Foley. Right behind it, we have surgical site infections, and we also have pneumonia and also central line infections. And so we need to make sure that as healthcare practitioners, we are following the policies and procedures that have been implemented to stop these particular types of infections. Your book goes on to talk about what we call iatrogenic infections, which are the direct result of a diagnostic or therapeutic procedure. And so we need to understand, for instance, when we break the skin barrier, we place the patient at risk for infection. And I think you guys understand that. We need to understand there's a reason why we do hand hygiene. And still, hands are the most common vehicle for the spread of bugs. And so we have insufficient hand hygiene, and we need to make sure that we become diligent about our hand hygiene and that we do not develop poor routines. And so on page 564, in the bottom paragraph, it goes over what is considered to be routine hand hygiene according to the CDC. And I want to make sure that you guys understand this and that you are following this. And this is something that you learned in Essential Concepts. Okay, next, so the prevalence. So what are your chances of getting an infection from work? So what you need to remember is to implement what we've studied. You need to make sure that you follow what is proven to be effective in the prevention of diseases. You know, your book talks about your chances, for instance, of getting Hep B and Hep C. Get your Hep B vaccines, right? Risk factors. You know, we look at risk factors. You guys already know some of this. For instance, we know that steroids, chemotherapy, radiation therapy all lower your immune response, and that places these patients at great risk for infection. You guys understand that if we break the skin, our normal defense mechanism, this increases the likelihood of getting an infection. Someone who's not nutritionally sound, someone who has a protein deficiency, they're more likely to acquire an infection. Certain diseases lower our immune response. So what do you guys need to know? Well, on page 567, there's some infections that are listed, and many of these we're going to cover or you guys have covered. For instance, cellulitis, you guys talked about in the first semester. You know, it's an acute bacterial infection. You can look at the signs and symptoms and know that we give someone antibiotics, antipyretics, and try to make them feel better. We are going to talk about UTIs, pneumonia. You guys talked about otitis media in pediatrics. It is the flu season. You know that the flu is a highly contagious viral respiratory disease. You can look at the signs and symptoms. You understand how to treat it, and that we can give antiviral medications to reduce the duration of the actual flu. And then we're going to talk about tuberculosis. And the last is sepsis, and we already mentioned what sepsis is. And you can look at the signs and symptoms of sepsis, and then you can look at how we treat it, but certainly we have to treat it with antibiotics. Okay, when we go to tie in other related concepts to the concept of infection, it's easy because we've already, for instance, talked about COPD, and we talked about the fact that COPDers are at increased risk for getting pneumonia. And so pneumonia certainly affects oxygenation and ties in with infection. When we look at elimination, we're going to talk about UTIs. This is obviously an infection of the elimination system. We could also tie in the fact when people get E. coli. When we look at inflammation and tissue perfusion, I think of cellulitis, which you guys have already learned, and it ties both of these very nicely together. And then teaching and learning, we must educate the public on the prevention methods that are available from, for instance, like from hand hygiene to immunizations, and what is a good immunization schedule. Next on page 569, it starts to talk about disinfecting things. And so this is probably something you're very familiar with when you guys are in the hospital. And so you know that a disinfectant is used on an object. And you guys see this all the time. We wipe down the bedside tables. We wipe down the non-invasive blood pressure cuffs. We wipe down the beds, right? And so we wipe down the side rails. And so a disinfectant is actually a chemical that's used to clean objects, as where an antiseptic is used to destroy bacteria or organisms on the skin or tissue or both. And then it helps to prevent the growth or replication of this organism. We know that the majority of what we use in the hospital is soap and water. We know that we have the antiseptic foam or gel, which has a high concentration of alcohol in it. But then we realize that this is not effective for everything, that there's times, for instance, that we need to change and only use soap and water and not use the antiseptic. And so if you're looking at the bottom of page 569, you realize that certain types of agents are only good for certain types of organisms, and that's important to know and understand. When we go to clean something, we have to think about exactly how dirty is it, you know, how should we be mixing the disinfectant, and is it okay to use in the presence of soap? Is it okay to use in the presence of organic materials? And can we treat all the surface area that we need to treat with it? Talking about sterilizing, this is on page 570 in your book. And just realize sterilization is a process that destroys all the microorganisms. So, it's a step above, obviously, from disinfecting. And there's common methods listed in your book. One very common that you might be familiar with is moist heat, and that's because of an autoclave. So, for instance, if you go to the dentist, or if you go get your toenails done or your fingernails done, a lot of times they will pull out a package that has been autoclaved. And this is just instruments cleaned under steam pressure, has to reach a certain temperature. The disadvantage is that it's really only for items that are solid because it uses heat and moisture. Ethanol gas or ethylene gas destroys microorganisms by interrupting their metabolic process. The problem with this is often whatever chemical we use, it is toxic to human, and caution has to be taken when utilized. You guys are familiar with boiling water. We live in Florida. If we have a hurricane, our water source gets contaminated, then you know that this is the old style and that you can boil your water to drink it, minimum 15 minutes. Well, we can also utilize this technique to disinfect articles. And then radiation. Radiation is not used, for instance, in like the decontamination or sterilization of surgical instruments, but because it doesn't really penetrate solid items, but it can be used to for certain things such as food and drugs or other items that are sensitive to heat or moist heat. Next in the chapter it talks about how to put on PPE, donning and doffing, as you guys learned in Essential Concepts. And certainly, if you need a review, there are different videos on YouTube, but also just you need to review your isolation practices. You know that there are different types of isolation. You guys learned about these also in Essential Concepts. So just read through this as you need. It's a rather long section that talks about your PPE and the different articles that we use for PPE. And then on page 572, it talks about the different types of isolation precautions, box 9-2, and it goes through various types of precautions. It also talks about, starting on page 573, what do we do with our soiled equipment and supplies. And so you guys certainly learned about this in Essential Concepts. This is something that you also see when you're in clinicals and hopefully understand the process. So spend whatever time that you need in reviewing this information. Next on page 574 and 75, it talks about the sterile process, sterile technique, which you guys really have been learning about along the way in nursing school. And so it talks about the sterile field. You guys understand this. You had to understand this, for instance, when we did sterile dressing changes in Essential Concepts, and then we've moved into trach care and central line care and Foley insertion. And so on table 9-6, you guys realize that there's principles and practices of surgical asepsis, and we will actually address this more clearly in complex sim because we're getting ready to enter into perioperative care. When completing a nursing assessment on someone suspected of having an infection, obviously we need to do an observation, talk to the patient, interview them, and perform a physical exam. And while your book separates these, obviously you guys understand that often we're doing observation and talking to the patient at the same time. And so we certainly want to observe when a patient comes into an acute care facility or an urgent care, maybe a physician's office. What do you perceive as the patient's current condition? We want to look at their skin, we want to look at their scalp, their eyes, we want to look at the presence or absence of any kind of foul odor. Do they have an elevated temperature? Are they having respiratory difficulties? Do they have, signs and symptoms of pain? When we're assessing them, we certainly want to interview them. There's certain things, depending upon the patient's complaints, that you would ask. For instance, if they come in with nausea, vomiting, diarrhea, have you traveled recently? Ask them about their immunization status, PPD test. Are they currently taking any antibiotics? When you take their vital signs, you want to ask them, have they actually taken any kind of anti-inflammatory meds, anything that would lower their temperature, past surgeries. Do they feel like they have an infection? Are they currently being treated for an infection, or have they been exposed to someone who has a infection? You want to do a physical exam, and of course we want to take vital signs. You guys understand that if someone's febrile, a lot of times then they will become tachycardic and have an increased respiratory rate. If they're complaining of ear pain, then it's possible that we would need to look inside the ears. The oral cavity, you want to look, how the lips get really cherry red and dry when someone is sick, or take a look if they're complaining of a sore throat. What's their tonsils look like? Do they have tonsils? Look at their eyes. Are they complaining of their eyes? Is there a discharge? Are they crusty? Assess their lymph nodes. Are they enlarged? Look at the respiratory assessment. Are they coughing? If they are coughing, is it productive? If so, what does it look like? Do they have tachypnea? What are the breath sounds like? Do they have bronchi, crackles, wheezing? Look at their skin. Has there been or is there a rash? Is it red? Are they pale? Are they sweaty? And then ask them about UTI signs and symptoms. And these are just a few of the assessment techniques that you would want to perform. Obviously, one that your book doesn't really address is if someone comes in and has a particular wound that they're concerned about, then you guys obviously understand that we would want to assess it, and that we would want to note if there was drainage and what it looked like and what it smelled like. All right, so next we're going to move on to diagnostics. If someone comes in, we suspect that they have an infection. Obviously, you guys understand we've talked a lot about CBCs this particular semester. We want to look at the white count. If the white count is elevated, then we need to look at the differential. So what kind of white cells do we have? How many circulating neutrophils do we have? We understand that this is a response to infection. We might look at what we call their procalcitonin, which does increase during infection and sepsis, and sometimes can be accepted as a marker for sepsis. You guys understand that we want to do cultures. There's lots of different types of cultures that we can do. You guys understand that we can culture any kind of drainage that we find, and you also understand that we can culture the blood if we suspect sepsis. We can culture stool, which we often do to see what type of organism is growing, and a lot of times we want to culture the urine if we have a urinalysis, which is listed here, that comes back positive. So how that usually starts is someone comes in complaining of UTI symptoms. We dip their urine for a urinalysis, and we see, for instance, that maybe they have the presence of nitrates or white blood cells, red blood cells, and then we understand that we need to go ahead and send the urine down for a urine culture and possible sensitivity. The serologic testing sometimes is used to detect antibodies, but we understand that it is not as specific as doing a culture. And then when you look at antibiotic peaks and troughs, what you guys are going to find in the healthcare setting is that certain antibiotics can actually be monitored by serum lab testing. And so the physician or the healthcare provider will order for us to test a therapeutic range. So, in other words, what is minimum and maximum blood levels of this particular drug that make it effective? And so a peak is when we draw blood 1 to 2 hours after we give them the medication, if it was orally, or 1 hour if we give it IM, or 30 minutes if it was IV. And a trough, which is a little bit more common, is what we perceive as the lowest level of the drug, and it's usually drawn right before the next scheduled dose of the medication. We get these levels, we make sure that the levels are therapeutic and that they're within range. And then I listed radiology. There's just a lot of different radiology type of procedures. Someone comes in, we think that they have pneumonia. We want a chest x-ray. Someone comes in, we think they have osteomyelitis. They need a bone scan. And so there's different types of radiology procedures that can be performed when a patient is believed to have an infection. Okay, so when we are talking about independent nursing interventions, certainly we need to focus on prevention of infection. So you guys need to always come back to the skill performance and how you were taught. Don't take shortcuts. I know that you see this often in clinical practice, but there is a reason we do the things the way we do them. So when you're doing central line dressing care, inserting a Foley, priming an IV bag, and you know that you have contaminated, you must stop and reset. So do not take shortcuts for skill performance. We want to be able to identify the signs and symptoms of infection. And these are pretty easy to understand, but you need to understand that it then requires follow-up. So once you have that individual who, for instance, has an onset of a new fever, it's your responsibility to identify that and call the healthcare provider. And then, of course, we want to maintain isolation. Whatever kind of isolation it is, we need to make sure that we're following the protocol once again that was set forth, because there's a reason. And the big reason is to prevent the spread of infection from patient to patient and to you. We then move on to healthy coping, and in this particular instance, we're talking about the patient. We place a patient in isolation, and a couple of things happen. They, one, for instance, can suffer from what we call sensory deprivation. It's been studied, guys. It's been studied that these guys receive less attentive nursing care because it is somewhat tedious to go in and put on the isolation gear, render patient care, and then exit the room properly. And so you have to realize that people that are in isolation can experience sensory deprivation. They also can experience lowered self-esteem. It has been proven that people who are in isolation, especially if they place a high value on cleanliness, that then they feel dirty, soiled, they're at fault, they're below your standards, and they also feel isolated, as we said. And so we need to make sure that as nurses we provide the care that these patients need and address these two particular issues. And then last, we need to make sure that we provide education to our patients' families, the public in general, the community. We want to identify the risk factors that are associated with the development of infections. We've talked about a lot of these. For instance, we talked about having COPD and being at risk for pneumonia, and get your pneumonia vaccine. Get your flu vaccine. We've talked about diabetes. We've talked about diabetes and the micro and macrovascular complications and the risk factors for developing foot ulcerations. We want to make sure that we educate patients on what type of screenings they should be getting, and to make sure that we educate the community, the patients, the families, regarding immunizations, immunization schedules, and what immunizations are due, for instance, on a yearly basis, maybe or just a one-time immunization, and that we follow up with the community on these screenings. When we talk about collaborative therapy, first, just quickly, when we talk about surgery, there's lots of different surgical interventions for an individual who has suffered from an infection and has developed a secondary complication. We talked about amputations in relationship to microvascular complications and macrovascular complications for diabetes, and that is the number one reason people have amputations, and often they present with an infected wound. A lot of times wounds, in order to heal properly, actually have to have what we call an IND, which is an incision and drainage, so we can go in and clean up the area drain anything that is present. Make sure that there's an exposed, healthy tissue bed. It could just be simply that we need to insert a central venous access device. Someone who has osteomyelitis needs weeks of antibiotic therapy, and so they're going to need a central venous access device. So maybe they need a PICC line inserted. And then you guys talked about otitis media, and chronic otitis media leads to the insertion of myringotomy tubes in the pediatric population. When we look at the pharmacology, wow, there's so many different antibiotics, antimicrobials. So I did post a PowerPoint for you guys outlining these and what you learned in fundamentals. But if you look in your book on page 582, you'll see one, it starts to talk about the antibiotics. It talks, for instance, about the aminoglycosides. Aminoglycosides, you guys will realize, are useful in combination with other drugs. They kill gram-negative bacilli, can be used in TB. When we give someone aminoglycosides such as a tobramycin or a gentamicin, we worry about the kidneys. That's important to understand. And also we can have hearing loss complications. The next one are the macrolides. When you guys look at these, this is good for gram-positive cocci, chlamydia in females. You guys will see one that's used is erythromycin. Tetracycline is mentioned. Tetracyclines, they're good for common skin infections, respiratory tract infections, often used in the treatment of acne, severe acne I should say, STIs. The one thing with the tetracyclines, it makes your birth control ineffective, and so we'd have to make sure that we pass that along to the patient. We also know that they stain teeth in children and that they cannot be taken with dairy products. Next, it talks about your cephalosporins. The cephalosporins are considered to be broad spectrum, closely related to the penicillins. Treat lots of different types of bacterial infections. You'll find there are a lot of different generations of these. You guys hear them called Kefsol and Ceph. And then the penicillins, which are broad spectrum and treat many different kinds of bacteria. The sulfa drugs, you guys understand, are common. The Bactrums, the Ceptras. They're used to treat a lot of different types of infections, sinus infections, UTIs. And then the fluoroquinolones, there are, again, multiple classes of this particular antibiotic used for a more serious infection. You guys hear this ciprofloxacin, a lot of times we call it Cipro, Levaquin, a lot of times we're hanging these in the acute care facility as an IV piggyback. Next, you guys see the antifungals. The antifungals, fluconazole, you guys, and nystatin are popular. A lot of times we have antifungals that are also given along with an antibiotic. It talks about the antipyretics. You guys know acetaminophen. We've talked a lot about acetaminophen. It's, processed through the liver, so we have to make sure that we have good liver function. We've talked about antipyretics, analgesics, the whole ibuprofen class, and we understand that they're hard on the kidneys, so we want to make sure this individual has good kidney function. We're not going to talk about the antimalarial. When you get into page 583, it talks about the antiretroviral, and we'll talk about these particular classes of drugs. There are several when we talk about HIV/AIDS. One of the most important things that we can do when we do have someone who is on an anti-infective is that they need to understand, yes, after a day or two of taking the medicine, you're going to feel better, but you need to take the full regimen of the prescribed therapy. This is the issue in the United States. This is one of the reasons that we have bacterial resistance in the United States, because people feel better and they don't complete their antibiotic therapy. To wrap things up, we talk about lifespan considerations. When you talk about infant, children, and adolescents, just understand the majority of their illnesses are viral in nature. This requires education. Parents need to be patient and realize that antibiotics are not necessary. We need to understand for newborns that the rules as far as fevers are different, and that we need to report fevers at a much lower temperature. than adults because their immune response is not the same. Also, that infant population is at risk for febrile seizures. This is something we want to educate the parents about. We want to teach parents or just the general population about good hand hygiene. And then when we get to adolescence, we want to make sure that we talk to them about sexually transmitted infections. Often when we are talking to an adolescent about a STI, if they're sexually active, we need to talk to them in private because this is something that they might not want to talk to you about in front of their parents. And so we need to make sure that if we, for instance, have a young female come in, she's having repeated UTIs, we need to talk to her about possible being sexually active and that they're at risk for STIs. A lot of times they don't understand how STIs are transmitted, and therefore it places them at potential risk. And then when we focus on the older adult, we know that they're at increased risk of infection because, one, they have a lot of chronic conditions, which we've been covering in class. Two, a lot of times they can have a poor nutritional status. They can have just the natural changes that occur in their systems that place them at increased risk. And then they have medication use that might place them at increased risk. All right, guys, that wraps up this PowerPoint for the concept of infection. If you guys have any questions, you know where to find me.